Let's discuss a topic most people find painful. That's getting a root canal. Actually, we're going to discuss something that people find even more painful, and that's dealing with healthcare customer service. But we'll review some strategies and tips and tricks to make you more productive when you have to do it and make it a less frustrating experience for you. My name is Adam Gross, and I'm an independent patient advocate and the founder of Peak Health Advocates. I help people facing health insurance challenges, medical bill challenges, need help coordinating care, or need assistance navigating the healthcare system while caregiving for a loved one. We're going to break this down into 5 sets of strategies. And before we dive into it, remember, if you like the content, please like, follow, subscribe, and comment. So let's dive in. The first set of strategies I'm going to discuss I call blocking and tackling. It's a sports analogy for the basics. And number 1 is schedule enough time. You already know these calls can take a long time. You can be on hold for a while. Don't try to do this when you got to leave the house in 15 minutes. That's a recipe for disaster. So schedule enough time and buffer. Number 2, prepare beforehand. All the information that you have about the issue that you're calling about, have it at the ready, either written down or on your phone or a file on your computer, but have it ready so that when you're speaking, you don't get flustered because you don't remember something or you're not sure and maybe you then need to call back. So just have everything ready. It's a little bit like prepare for the worst, hope for the best. Likewise, number 3, prepare your objectives before you call the call center. What is the question that you really want answered? What are the relevant details and what's irrelevant? So imagine a pair of binoculars. You can zoom out for a wide view. You can zoom in for a really narrow view. Well, the more you zoom in for the agent, the more you're going to help them be more productive and more likely that they'll be able to resolve the issue for you. If you put yourself in their shoes and you're feeding them a bunch of details that end up being irrelevant, it's just harder for them to sort through that and resolve the problem for you. So prepare your objectives, sift through the relevant and the irrelevant before you speak with someone. Now, while you're interacting with an agent, document everything. Who you're talking to, times, other names they mentioned, departments. And healthcare information can be complex and sometimes intimidating. Ask for spellings. If you don't understand something, ask in a calm, measured tone. I'm sorry, I don't understand that. Can you please explain it again? And if an agent tells you that they're going to do something, call your doctor's office, call your insurance company, whatever, call another department, whatever it is, get a timeline. And if you get a non-response response, ask again. If you persist and can't get to a specific date, try to get a range. But write that down, and unfortunately, you're going to need to follow up on it. We all know a lot slips through the cracks. So if you get a commitment that so-and-so is going to call Dr. Smith on Thursday, follow up to make sure that happened. All right, last one. While you're interacting with an agent, there's no reason why you can't keep your favorite AI app open, whether it's on your phone, your computer, or just Google. Look up information that may prompt you to think about some questions while you're on the phone and avoid having to follow up. Now, just be careful, especially with AI, right? Don't feed the agent irrelevant details or incorrect information. So you got to have a little bit of a filter. The next strategy we're going to discuss, you're going to think is obvious, but in healthcare, it's of paramount importance, and that's emotional intelligence. Given the frustrating nature of our healthcare system and the fraught issues that we're trying to manage, either for yourself or especially for a loved one, it is easy to get frustrated and overwhelmed. But the more you can stay calm and cool, the more productive your interactions will be and the higher likelihood of leading to resolution. So the first tip is just try to remember that the customer service agent that you're dealing with did not cause the problem. Now, I'm not saying you're always going to be dealing with perfect human beings, because there are no perfect human beings, and that agent may not cause some other problem, but 99 times out of 100, that agent did not cause the problem that's leading you to try to get something resolved. So just trying to remember that gives you a little bit of a detachment. Then sometimes saying that out loud, I know you didn't cause the problem, but can disarm both sides of the conversation. Number two is use calm, measured tones. And that's going to make your conversations more productive. It's going to make it easier for the agent to work with you. That doesn't mean that you can't convey urgency or convey disappointment, but you use professional words and a professional tone, and it'll lead to better outcomes. And the flip side to all this is if you do lose control a little bit and are overly emotional, sometimes companies can use that against you. So we want to have emotional intelligence, both because it's the right thing to do, because it's more productive. On the flip side, we also don't want to give them any more ammunition not to want to help you. The next strategy is use the right channel. We think of calling in to a call center, but there are other options that we can utilize. First, what are your self-service options? For simpler stuff, log into your account and see if you can answer the question. It's what we all want to do anyway. And if you haven't registered for a member portal account with your health plan, your account with your doctor's office, go ahead and do that so it's not an issue when you do need them. Now, even if you can't answer all of your questions, you'll probably find out some information, and then you'll be better prepared when you do need to ask an agent. So another option is chatting. Now, I'm not necessarily referring to the automated chatbots, which generally are pretty limited in healthcare. That can change over time, but they are pretty limited in what they can do. I'm talking about chatting, typing with an agent, a live agent on the other side. And you may need to go through the automated chatbot first before being transferred to an agent. One benefit of it is automated documentation. You have a typing conversation with an agent, and then you hit the download transcript button. And you've got all your information, and you've got all your names, and you've got all your times. Another benefit is the ability to control your emotions. So we talked about emotional intelligence in that segment. You can take a second to respond. If you see something that kind of sets you off a little bit, you take your hands off the keyboard. You can type a response and then delete it. So it's a really good mechanism for controlling our emotions. And oh, by the way, it's okay that it takes a couple minutes to respond both ways. That agent is actually working on other tasks at the same time. And they may ask you at some point, do you need another minute? Are you still there? Yes, I am. I'm just need to get back to you. That's totally cool. Another benefit of chatting is you can confirm information you've already found on the website. So for example, when I'm trying to identify whether a service is covered by my health plan, I look it up in my member portal. and then I chat to get a confirmation from a real human being. And I hit the download transcript and I've got it documented that on so-and-so date, yes, that service is in fact covered. But as I said before, chat does work best for simpler interactions, and sometimes there are interactions and questions which are best for calls. If you think about talking with somebody versus typing with somebody, there is something lost in not hearing another person's voice. So that is just a reality. And if you're wondering why I haven't mentioned email, it's because don't worry about email. Email is not going to get you very far. There are times when you need to email. For example, within your doctor's portal, messaging via the portal, such as MyChart, can be incredibly effective with your doctor's office. So I don't mean to dismiss it completely, but if you've got an urgent issue, it's not the best way to go about solving your problems. In this segment, we're going to discuss why dealing with customer service is like being a salesperson and how that framework can make your interactions more productive. If you've ever done any sort of sales job, you know that your target audience is divided into yeses, maybes, and nos. There are people out there who are perfect, really need your product. They're not going to need that much convincing. Those are the yeses. On the flip side, there are people who do not need your product and they're never going to buy from you. Those are the no's. And the vast middle is the maybes. With some convincing, you can convert them into yeses. Likewise, customer service agents you deal with, you can think of them as kind of yeses, maybes, and nos. Those yeses are the customer service agents who are so helpful. They are going above and beyond. When you come across them, you feel like you have struck gold. There's the nos, folks who aren't helpful. And then there's the vast middle of maybes, people who probably naturally want to help you. Maybe they're newer at their job. Maybe they're having a bad day. They need a little bit of work to get them to help you as much as that yes. Let me give you an example. I was at Target recently and I was wandering the aisles looking for a product. And as I wandered, I came across an employee and I asked her if she knew where the product was. And she looked at me and said, no. Not very helpful. Now, the natural question or the natural follow-up would have been like, oh, but check with this other employee. Or, I think it's in this section. I thought it was a better use of my time to proceed and try to find another solution. So that's what I did. I thanked her. I moved on. I moved in the general direction where I thought the product was, and I found another Target employee, and I asked her where the product was, and she knew exactly where it was, and she pointed me to it. Great. First one was a no, and then I found someone who could help me. So this gets back to your strategies for your calls, right? If you get a customer service agent who's just not helpful, is just a no, you're just not getting anywhere. You know, if it's a large enough organization like your health plan, if you call back, you are almost certainly going to get a different person. If it's a smaller organization, that may be less likely. Asking to escalate to a manager is always something to keep in your back pocket. Just keep in mind, then that becomes labeled as a problem, and then you have to wait for the manager, who's by definition has more limited availability than customer service agent. So keep your ears perked when you're interacting with customer service agent, and identify, is this person a yes, a maybe, or a no, and tailor your questions and conversations as appropriate. In this segment, we'll discuss how interacting with customer service is like visiting the doctor and how to use that framework to make your interactions more productive and less frustrating for you. So, when you think about going to the doctor or nurse or dentist or physical therapist, what are they doing while you're with them? Well, they're listening to you. They're looking at other information to understand your context. And at the end of the day, they're trying to make a plan for you. Well, a customer service agent is doing the exact same thing. They're listening, they're looking at your information, they're asking questions, they're taking input, and they're trying to resolve the issue. 2, your care team, your medical team, as we unfortunately know, is pressured by time. It's an unfortunate part of the U.S. healthcare system. Likewise, customer service call centers are pressured by time. They are measured on how many calls they can get in a day. So your agent is likely measured the same way. 3, your doctor, again, or nurse or physical therapist is naturally curious. You don't become a neurological surgeon but without being incredibly curious about what's going on in the human body. Likewise, customer service agents are problem solvers. That's their job. It's problem solving. And to have any degree of skill, you have to be curious. 4, your care team, members of your care team are naturally empathetic. Registered nurses have some of the deepest wells of empathy about the condition of fellow humans that you will ever encounter. And likewise, if a customer service agent is any good at their job, it's because they have an empathy. You cannot sit and listen to other people's problems at the end of the day and try to solve them and stay in the job without a true sense of empathy. So in those ways, your customer service agents are like your medical team. Okay, the first thing you can do gets back to our blocking and tackling segment. Prioritize information, identify the relevant details, go into the interaction with an objective and some questions and prepare beforehand. And that helps everybody be more productive. We talked about how you can kind of, the binoculars analogy, zoom in as much as you can on the relevant details, and that helps them be productive. Leverage their curiosity. Ask them, what do you think about that? Or why do you think that's happening? I'm curious to know why this may be happening in a non-confrontational way. Can you help me understand? Pique that curiosity, and likewise, pique their empathy. Do you understand how I feel? Do you understand why I might be upset about that? Again, calm, measured tones. And if you remember from our emotional intelligence segment, the person at the other end of the line likely didn't cause the problem. So they're likely very empathetic to you. So pique that empathy. And all of this in combination, you're going to bring people to the side and make the interaction as helpful as possible. There you have it. 5 strategies for making healthcare customer service more productive and less frustrating. I really hope you enjoyed the content. And if you did, don't forget to hit the like, follow, subscribe buttons, or leave me a comment. And if you need help navigating healthcare, please feel free to reach out. My contact information is on screen and it's in the description. Again, I hope you can put these strategies to good use and improve your healthcare journey. And I hope to see you in the next video.